we're going to be talking about the management of lateral hip pain, and this is very local pain on the outer part of the hip, just here. If you notice, I'm not talking about the posterior part of the hip here. That's a different thing, often associated with lower back pain. I'm talking a pain on the bony part of the outer part of the hip here. And usually, if you're a patient, you can put your finger right on that discomfort. You get pain when you're lying on it, you get pain when you're going up and down stairs, etc. Now, it's a very commonly misdiagnosed condition, and to be honest, it's quite difficult. It's like Bermuda Triangle, lots of things going on here that can refer into it. But I'm going to give you a few of my tips that seem to help with this problem. So, it's a very common problem, particularly in women, because we have wider hips and the muscles tend to have to go over those bony points. And that can create traction, which often gives a tendinitis local into this spot. So the first thing we want to do, if you've got a muscle that's irritated, we want to make sure with it we take all the tension off that muscle. So that means no standing like this, which is going to be putting it on tension. So if you do have to stand for any length of time, put your foot up on an object or something like that, or try and keep your weight evenly between both of your legs. Also, no sitting cross-legged, because that really irritates the problem. So if you're sitting and you've got one leg crossed, obviously you're going to be putting tension on this muscle. We want to try and avoid that, so sitting with both legs out nice and straight in front of you. Now, there are some really good exercises that help with this condition, and luckily they're very simple to achieve. So, if I lie on the floor, and I'm going to put two pillows between my knees, and this is the sleeping position that you need to adopt. So you sleep with your bad side on top, and if you see, it's in a nice neutral position. It's not dropping down onto the other leg, which is going to put it on tension, and that will exacerbate your pain. So at least two pillows between your knees and relax into that position. That's going to keep it nice and safe. So the exercise that I want to show you involves being in this position, and obviously you can do this on the bed or on the floor. Straighten the affected leg out, making sure that it's still supported on those pillows, and it's just a very tiny movement up off the bed. So I'm keeping my legs straight, I'm not bringing it forward, it's in line with my spine, I'm just lifting it up about 1 centimetre off the pillows. I'm going to hold it in that position for as long as you can. Now that can be anywhere from 20 seconds to a minute, and it's the length of time that you hold this for that's important. It's not a question of doing 10 repetitions quickly. I'd much rather you did 1 or 2 and you held it for a good length of time. So we're going to hold that for up to a minute. When that time is up, you just gently relax back down. In an ideal world, I'll get you to do that about 10 times every day. It doesn't matter if you feel an element of discomfort as you're doing this exercise. In fact, it can be quite useful to relieve pain if you've got it at the time. So those two exercises are a great way of relieving this lateral hip pain. Good luck.